Hafide, I'm Leah Claveo with the Joint Region Marianas Public Affairs Office, and welcome to another episode of In Focus. We want to take the time to bring awareness about cancer and the ways that we can fight to prevent it from occurring. We start out this episode with Darlene Roberto, who is a mother of two, an administrator at George Washington High School, and who is diagnosed with stage 2 breast cancer.
My cancer journey began in 2010, so about 5 years ago, and it was something that I did not expect would ever happen to me. I remember waking up one morning and being in so much pain that I was, in tears, and it was really painful around my left breast area. And so I was still, very groggy, waking up in the morning, and I felt around my breast, and I felt a very big lump, and I really didn't want to believe what I was feeling, and I went back and felt it again, and it was very painful, and I started crying because I had a suspicion that this might be something that I was not prepared for.
Roberto is only one out of many who have fought this disease. In response to the increasing concern of cancer within our community, the Department of Public Health and Social Services established the Guam Comprehensive Cancer Control Program.
The program exists to support the Guam Comprehensive Cancer Control Coalition. And what that is it's a group of collaborators, working to pool its resources to reduce the burden of cancer in Guam. And so its focus really is on the full spectrum of prevention and control, which is, again, risk reduction, early detection, better treatment, enhanced survivorship, and all those things. And that's what we try to do. Through the program, we support our coalition partners, our coalition members in the fight against cancer. What we've seen is not only is cancer the second leading cause of death in Guam again, but for incidence rate, so new cases of cancer, right? It's 2003 to 2007. The total number of new cases for cancer is 1,580. Between 2008 to 2012, that's the new study, we got 1,904 new cases of cancer, right? And so that's alarming. For deaths, between 2003 and 2007, there's 720 deaths. In 2008 to 2012, there's 736. It's increasing. So in cancer, and in other diseases as well, there are two things that you have to look for: the unmodifiable factors and the modifiable factors. Those are the unmodifiable things, like if you have a genetic predisposition to having cancer. But there are things too that you can modify. For example, lifestyle behaviors. For many years now, we've been really pushing our community to, look at prevention strategies, exercising correctly, doing physical activity, physical fitness, proper nutrition, stop smoking, definitely, obesity prevention, really. We're making it hopefully easy for our community members to get out there and do something about their health, right? But it doesn't start with us. We just help build infrastructure and all those things, but it really has to come from you. We are in a world now where we can really do something about our health, right? If you want to get yourself screened, we have the services available here on Guam. And I think it's very, very important to educate ourselves, because it really starts with you, right? It starts with you, and hopefully you can educate your family.
Because of this, Guam Cancer Care, a local nonprofit organization, was established in 2011 to help local cancer patients with direct support services, but also focus on awareness and education.
The reason why they added cancer screening prevention after they had been developed was because about 90% of the patients that were coming in were being diagnosed at stage 3 and 4. And we really needed to make some form of movement on island to catch cancer at stage 1 and 2, where the survival rate was so much higher and the financial burdens were so much lower. And in addition to that, just this education and outreach to let the community know what they needed to do in order to prevent, and how important screening is, and that screening does save lives.
To address this, Guam Cancer Care hosts a series of town hall meetings geared at increasing dialogue and education in the community. They have also reached out to local schools to implement the Kids for the Cure program.
We provide the teachers with tools for, lesson plans, and then we also provide the students with the supplies needed for the in-class curriculum. They learn about cancer cells, cancer development, and also prevention in class. What makes our program unique is that we've incorporated a physical activity component to it.
The reason why they picked the 3rd, 4th, and 5th graders was because that's the best age where the children haven't developed bad habits yet, and they're still very much a sponge and they like to learn things. And we're hoping that with this age range that they will learn very good habits, healthy eating and healthy living, and adopt exercise into their daily schedule and make positive choices for themselves in middle school and high school and so on.
The American Cancer Society is another organization that is part of the cancer awareness and education movement within the community. They have contributed to cancer research as well as host the annual Relay for Life, the largest cancer awareness event on island.
The American Cancer Society has been involved in cancer prevention studies that have proven the direct link between certain cancers and behaviors. For instance, CPS1 discovered the direct link between smoking and lung cancer. And then CPS2, obesity and lung cancer. So tobacco prevention and getting our community more active, physically active and more cognizant of their nutrition and what they're eating are a couple of the examples that we use, and we encourage our teams and educate them about the importance of doing that and providing them the resources and the tips to integrate it into their lives. We know change, behavior change can take a long time, so we just constantly reiterate to them the importance of it and encourage them to take action and pledge to do what they can personally to help reduce their risk of cancer.
What can you do to fight back in your personal lives and your sometimes even at your work sites, that sort of thing. But really it's, we talked about nutrition and diet starting there. For parents who have children, it's making the conscious effort to think about those things and to make those sorts of things a priority, whether it's scheduling time for the family to be physically active together, whether it's riding bicycles together or planning a day at the park or at the beach, consciously packing healthier lunches for their children, for example, when they send them to school. And then for the adults, it's also particularly the consciousness that those doctor visits are important and important for a reason, because those screening tests do exist to help find those cancers at the earliest stage possible.
I really believe now in cancer prevention. I mean, you hear it all the time. There's commercials, and the statistics for Guam itself is alarming. And as a community, we really need to work together. I mean, you see the amount of support at the Relay for Life for all these 5Ks and 10Ks and things like that. I mean, we're listening. I think Guam is finally listening and waking up, because our families and our friends we're all impacted by cancer. It's sad, but we really need to continue this fight together.